Welcome to Eye on the Issues. We are talking today with Dr. Brad Roberts, an ER physician, doctor out of Pueblo, Colorado. Doc, medical marijuana has been a big thing in Colorado for about a decade now. Other states have thought about it and moved in that direction. One of them is Wyoming. They've spoken about it, but they haven't gone there yet. Let's talk about what you've learned, especially over the last couple of years in respect to legalization of both recreation and medical marijuana. What has it done to Colorado?
Sure. I mean, it's a complex issue and there's lots of parts to that. I think in my personal bias where I work as an emergency room physician, we've certainly seen an uptick in particularly our mental health cases. Probably the most concerning to me are the psychosis cases. So for people who may not be as aware of what that means people who are, most people would say they're going crazy. They're hallucinating, having delusions of grandeur. And those are the things that are probably most concerning to me. We also have increases in our suicidality. We have cannabinoid hyperemesis syndrome, so people have uncontrolled vomiting as a result of that. And I think it's been an issue that we've been dealing with ever since. I think you'll see our substance abuse rates have skyrocketed. They've gone up across the country, but particularly more in Colorado, and I think that's a big part of what we're seeing. And then there's a lot of the other stuff that we see. There's adverse effects on your cardiovascular outcomes, adverse respiratory effects. We see infant ingestions. So all of that are things that you may not see yet if you haven't gone there, that we see regularly here. I think on the flip side, people would commonly say, well, yeah, but they tie this to tax revenues. And that's something that's another big part of it that we see as well.
So let's talk for a second about the potency of today's marijuana versus, for example, 20 years ago. That is a big deal. Can you explain that?
Yeah, so when people are typically thinking of your Woodstock marijuana, or maybe what they were using back in the 70s, 80s, it was more around 4 to 5% THC. And now your native flower, so the typical joint that you're giving is generally around 20% THC, which I point out to people, that's not double, that's not triple, that's not quadruple. You're talking multi-fold increases well beyond that. And that doesn't include when you get to concentrate. So I can take that native flower and then concentrate it out. So I pull that out into an oil, and then I can further solidify that oil until it shatters, and they actually call that shatter. And then once that shatter, you can reheat that and inhale it again on something called a dab. And so those potencies continue to increase in there. So you can go up from that 20% to almost up to a 90 to 99% THC potencies on that. So there's dramatic increases in what you're talking about from before.
So like 15 or 20 years ago, somebody could probably, go to college, come back, or after college, smoke pot a couple times a day, and it wouldn't be a big deal. But in this day and age, give us an idea of what you're seeing in the ER.
Yeah, one of the changes, so I think that we all need to make is we were used to asking people, do you smoke cigarettes? How much do you smoke? Do you drink alcohol? How much do you drink? But for some reason with marijuana and almost any other drugs, we left it as a yes or no answer. So we would ask them, do you use marijuana? And we left it at that. One of the changes I made is, do you use marijuana? How much do you use? And we were actually finding that where the old time days, people would go to a party once a month and you'd pass around a joint, you take a couple of puffs maybe. Now people are smoking 8 joints a day. And again, that's not what we're talking about from that 5% THC. They're smoking 8 joints a day of a 20% THC. So it's a dramatic difference from what people are typically thinking about.
And what are you seeing in the ER? I know there's a term that I've heard before. I'm not sure from you or somebody else, called scromiting. Can you tell us about that?
Yeah, so that's cannabinoid hyperemesis syndrome is kind of the medical term for that, but it's essentially people who have severe unrelenting vomiting, and they generally have fairly significant cramping, abdominal pain, and usually the pain and the vomiting are so severe that these people are screaming. And so in addition to the screaming and vomiting, we've coined this term scromiting as you combine those together. And it is fairly, I mean, these people come in and they look miserable. I mean, they just cannot stop. And unfortunately, a lot of our normal medications that we use for vomiting are fairly ineffective. So we typically will use Zofran or Reglan or Compazine. Those are things that we would use for vomiting that basically don't work in this. Essentially, what we end up having to do is a lot of antipsychotics or sedatives, and that's been the thing that works the most for this. And there's really no cure for it other than that they've got to stop using cannabis. And typically, because cannabis is fat soluble, so it's in your adipose tissue, it's released over a long period of time. People have to be off of it for, we don't know 100% the exact time, but I tell people 3 to 4 months is you'll need to be off of it, and then your symptoms are going to start to improve.
Obviously, Colorado has had both legalized and recreational marijuana for about 10 years now. Neighboring states like Wyoming, for example, there's many people there that are fighting the whole concept of any kind of legalized marijuana there. What advice would you give to the lawmakers and to the people of Wyoming, knowing what you know now?
I mean, the very simple advice is I wouldn't do it. I wouldn't legalize it at all. It is certainly not worth your tax revenues. I think it's often argued, yeah, but we're going to get these huge tax surpluses. Be able to tax it. You're never going to catch up for how much this is going to cost you from a numerous impacts. Your societal impact is probably the biggest. So we have a huge uptick. When I say psychosis, I just gave a presentation yesterday to the Rotary Club here, and we talk about, these guys that come in. Some of them have 10 ER visits in a couple months' time. They're seeing numerous psychiatric facilities. The police are involved, ambulance services involved. When somebody's psychotic and they're in the middle of the road screaming, throwing things at people. One guy I had recently just went into a church and interrupted the whole church, screaming at them that he was the god of thunder. That's huge interruptions in your society. And so I wouldn't take that psychosis piece lightly and say, it's a little psychosis. These people can be fairly major and cause some fairly significant damage. And they take a lot of resources to be able to treat and handle that. So when you're thinking about these tax revenues, it's not a one-sided equation of you're just suddenly going to get this money into these coffers. There's a lot of cost associated with that. And you'll see, I think Colorado, we never got these like, oh, we're going to be able to fund all of our schools and we're going to be able to fund, transportation projects and all of these things that we're going to do because the cost side of that is so much more. One of the studies I saw says for every dollar you gain in tax revenue, you're going to spend $4 taking care of it.
Wow. All right, let's talk for a moment, if we could, about the impact of marijuana on pregnant women. There's been studies done. I don't think the findings are good. And do you think pregnant women are aware of what could possibly happen when they do smoke marijuana?
So I think there's some things that have been good in that it's changed. When we first started this experiment 10 years ago, I don't think they did. I think that the women were using it to treat nausea and vomiting in pregnancy, and they had no clue. And I think, unfortunately, they were even being recommended this by certain places. That's gotten way better. I think now I very rarely see pregnant women using it. I think the understanding that this leads to numerous adverse effects, from adverse mental outcomes in the kids after they're born to intrauterine growth restrictions, so they can have certainly small preterm babies. That's been understood much more, and I think has actually improved over time.
Great. That's good to hear. Let's talk for a second, if we could, about fentanyl. Obviously, it's the big problem that's coming across the southern border right now, out of China to the cartels, and then it's distributed around the country, causing lots of deaths, up to 100,000 a year reportedly. Can you talk about fentanyl possibly are you seeing marijuana use, and then does that flow into fentanyl, or any thoughts on that?
Yeah, so certainly, if I get a criticism sometimes as I talk about marijuana, I was like, well, there's all this other stuff that's worse, and fentanyl is certainly one of them that gets talked about. And there's no question, people die from fentanyl, and that's a horrible, horrible drug. We're seeing huge increases that nationwide. We're here in Colorado, we are seeing increases in it as well. I think in regards to how does that have anything to do with marijuana, I think we have to understand how some of your brain works with the science of addiction, which is a little bit longer discussion. But anytime I use a substance of abuse, and that can be nicotine, it can be THC from marijuana, I get this increase in dopamine, and I'm actually changing some of the receptors in my brain and how they work. And I think there is been well documented this pre-sensitization that when I use those drugs, I'm more likely to suffer from addiction and abuse of other drugs. Marijuana in particular, one of the more interesting studies I saw, if I give rats THC and I have them push a button to get either more THC, nicotine, or opiates, they actually hit the button for nicotine and opiates significantly more than rats who were not given THC. Furthermore, there was another study that looks at the cannabinoid receptor knockout mice. And if I take out their receptor from the brain that was involved in cannabinoids, they actually don't have the same dependence to opiates that the non-knockout mice did. And if I give them naloxone, they actually don't have any of the withdrawal symptoms either. So clearly, from what we know, there is a significant cross-reactivity from THC, and what we do see is that places that have legalized have seen significant increases in their opiate addiction, and unfortunately, here in Colorado, we have not been immune to that.
Okay, two quick things that I want to finish with. Let's talk for a second of a teenager in Colorado, obviously, where you are starting to smoke marijuana, 13, 14, 15, whatever. What's the fear about what could happen to their brain and their mental capacity?
So it's a little bit of a complex question, and I could spend a whole hour talking about just that question. I think in the short term, I want to be clear. Sometimes kids will use this and think, well, nothing happened to me. I was fine. And they're not going to be wrong. Some of these are going to be more subtle, and it's going to take more years before you're going to see it. In the short term, you're going to probably experience a little bit of paranoia. And then over long term, you may develop those psychosis symptoms. But the longer you use, you actually do increase those symptoms of suicidality, which I think is the most concerning for me. But we also see decreases in overall IQ, decreases in your ability to form significant social relationships. And those kind of things I think are more long term that you're going to see that you won't see after that first time you did it. It'll take years before you suddenly realize, man, I've really lost out a lot. Now I'm sitting at home depressed and I don't have any friends. That takes longer to get to that point. And then again, the other thing that I think is really important is to understand how that addiction cycle works. Because I think a lot of times what I hear is, well, I use marijuana to sleep. It helps me sleep. And what really has happened is that you've developed that dependence over time. And so that when you stop using it, now you can't sleep. You become more irritable, and now you become dependent on a drug now that you need to take on a daily basis. And there's a significant financial aspect associated with that as well.
And also, let's touch base once again on the possible learning developmental disabilities of a baby brought into this world after the mom had smoked marijuana. Can you just talk a little bit about this to kind of get moms completely up to speed in case they're not?
Yeah, so we're still learning about that. We do see that if mothers have used, the babies who had that use in utero do have significant learning delays later on in life. I think those ongoing studies are still delineating out specifically what that means and what that looks like, but we are seeing learning delays, and probably most significant, delays in their ability to interact socially. So they don't seem to respond to a lot of the social cues and things that we typically would expect.
And states like Wyoming and other states that are kind of gradually legalizing marijuana, usually, of course, it starts medicinal, medical marijuana before it's recreationally approved from a legalized standpoint. What could you say to the people of the state of Wyoming that have not gone to that point of where it is legal from a medical standpoint? Is your advice to just don't go there, don't go anywhere near it?
Well, I'm a scientist, and so I'm not in, would say that I would still be in favor of studying it and to do the appropriate research and science behind it. And if there are excellent medical reasons that we can use this, why, I'm all in favor of that. I think the science has not quite got there yet. I think we skipped a lot of these processes, and I don't think any medication should be legalized by vote. I just don't think that's how this is set up. We have scientists and processes set up to be able to give us, appropriately studied legal medications that have appropriate uses, and that we understand there's contraindications, there's adverse effects, here's the appropriate dosing guidelines. You don't have any of that for right now. Right now, all you have is kind of a free-for-all where this dispensary gets set up in a bud tender. So your guy who just really knows nothing about the actual medicine is essentially making up the dosing. So when somebody here gets a medical card, it doesn't tell them how much they should use, how frequently you should use it, when do you stop, when do you start, are there contraindications, what about the other medications you're taking? None of that gets spoken of or talked about in this medical side. And as we've studied this further along in kind of the experiment that we've done here, most of the medical indications that we initially had prescribed it for, later research has shown really isn't there. So it's really been shown to be not very effective for pain, which is over 95% of the cards are given for pain. And in fact, there was a recent study that just came out in the Journal of the American Medical Association, JAMA, that showed that the placebo actually had greater benefit from pain than the actual cannabinoids themselves. And I think some of the other things, we're still the questions out. What about certain forms of rare epilepsy? Perhaps, but in those cases, we already have FDA-approved medications that we can use along those lines. So I would recommend using those as opposed to this dispensary medical card model that we've done here in Colorado.
Great, Doc. Great information that you shared. Is there anything you want to add that I haven't asked you about?
No, I think that it's important that those who are kind of on the fence that should really look into this, and that if you're going to talk about legalizing it, you do really need to understand that there's going to be a lot more consequences. I think it's commonly talked about, well, we're going to get all this tax revenue and it's not that bad. Again, you've got to understand that there's going to be significant increases in your psychosis and suicidality, the hyperemesis syndrome patients. So I would be involved, and I wouldn't sit silent on the sidelines. I would get involved and let people know that, hey, this is not what I want in my state.
And Dr. Brad Roberts, thank you for joining us for Eye on the Issues.